All right. Good afternoon, everyone. Thank you for taking the time to join this month's action period call. We have a lot of information, a lot of really great and useful information to get through. So let's go ahead and get started. Next slide. Keep going. There we go. As always, we thank the Ohio Department of Health, the Government Resource Center of the Ohio Colleges of Medicine, the March of Dimes, and the Ohio chapter of the American Academy of Pediatrics for their support. All right, perfect. And I see someone has taken the initiative and started the attendance chat. Thank you, Dr. Wong. If you would be so kind as to put your name and or practice in the chat for attendance purposes, we would greatly appreciate that, at some point in the next few minutes. But here is our agenda otherwise. We will be going through data from the GRC. We then have, I think, a really special presentation for us. This really focuses not just on how we care for our patients, but how we care for ourselves. Which I think is certainly as equally, if not more important. We've all heard the saying, to take good care of our patients, we have to care for us. And so Dr. Liza Halloran, who is one of our previous participants in a previous wave of this project, will be giving us some information on self-care in the age of moral injury. As time permits, we'll be having a discussion about the information she covers, and then we'll do some wrap-ups. Let's move forward. All right, the attendance chat is important. If you've not already done so, again, please put your name and practice in there. We do not have a Zoom poll this month. As mentioned, Haley is not here. She's enjoying a well-deserved vacation, and she is our Zoom poll champion. So since she's not here, we don't have a Zoom poll either. So instead, this is going to be a chat option. So think about briefly, think about a way that you help manage stress or practice self-care. So not something that you do for the patients, but something you do for you. And we've listed a few examples here. And drop it in the chat. I think it'll be interesting to see, if nothing else, and maybe give you some ideas. So we'll take a minute. I'll also fill this out, and we'll see what everyone has to say. All right, maybe a few more seconds. As of now, only 3 of us appear to practice any kind of self-care. So that makes today's conversation maybe even more important. Maybe there are some deficiencies here. Again, maybe we'll do 10 more seconds. If you have any suggestions, please throw them in the chat. Here's a few more. I love this, punishing the shrubbery. I feel like that's like my entire existence when I garden, is constantly punishing the shrubbery. This is probably why I can't grow anything well. Exercising in various forms seems to be a common theme. That is obviously great, has so many benefits, physical and mental wellness. Sitting at the beach, that is amazing therapy. I agree with that. Reading for pleasure. Yes, I agree wholeheartedly with that. I finished my MPH last December, and my one post MPH resolution, not a New Year's resolution, but a post MPH resolution, was reading more non-medical books. And it has been a lovely year to be able to do that. And that sticks out as something I've been able to enjoy a little bit more than I had before. And walking the dog. All right, we will move forward. Thank you. It does sound like many of you do practice some form of wellness or self-care, but Dr. Halloran will be discussing a little bit more about that as well. So moving on to the next slide. All right, Evelyn, are you on?
Yes, I am.
Hello, good afternoon to you. Thank you for taking the time to to give us some information and updates today.
No problem. Brooke, do you want me to share my screen, or would you be advancing the slides?
I have your slides. I don't have the aggregate pulled up, but I have your other slides.
Okay, all right. Good afternoon, everyone. My name is Evelyn Quarshi. I am a researcher with the GRC, and I will be going over the data review today. We will start with our data submissions update. So for wave 3, we've had 2,336 total submissions to date from 20 sites. And could you go back? Thank you. On the chart below is our trend of our submissions. And as you can see, we've had fluctuations throughout. So this is broken out on a bi-weekly time period. One thing of note is that in the last 3 weeks or so, we see an increase in the number of forms that we're getting, which is good because we have not necessarily seen an increase in the number of sites that are submitting. So let's keep up the good work and keep the data submissions coming. We will now move on to look at our aggregates charts, and I will share my screen for that. Bear with me. I don't use Zoom for sharing that much. I'm trying to find that screen. 1 second. Brooke, how do I, which option do I go to share?
Is there anything that says presenter view?
Evelyn, we can see the screen. You just go to the other tab, Web 3 tab. Yes.
Okay.
Yeah. Yes.
Oh. There we go. Thank you.
Oh, you just close the tab.
I need to, okay. Can you see?
We can see your Zoom screen, but no longer the data tab.
Oh.
You might have to stop sharing and then pull up the data tab again and then try to share again because it has to be on your screen to share it.
Okay.
And Evelyn, I can try to share as well if you're not able to.
Thanks, Shadia. I would give it one more try. All right, can you see it?
Yes.
That's good.
Oh, thank you. So for today, we are going to focus on our opt-in measure, and then our anxiety and depression related measures, and then our handout educational measures, just to see how we're doing on that. So we start off with measure number 1, which looks at the percent of women that are assessed for willingness to opt in to participate in the wave. For this measure, we see a steady increase overall. So we start off at around 86%, and by the end of September, we are at 92%. So this is really good. We are seeing that where a lot more mothers are being assessed for willingness to opt in. Next measure is measure number 2, which is the percent of women that are who received a screening for postpartum depression or anxiety. We've seen that this measure has been pretty consistent throughout, and we've hovered around 100%. So we are meeting our goal set at 100% for this measure. Measure number 3 is the percent of women that present positive for symptoms of postpartum depression or anxiety. We see an overall decrease in this measure. So at the start of the wave, we were at around 30%, and this has declined to about 16%, which is good. One thing I want to call out is that for the red measures, which are our clinical outcome measures, we are not necessarily in control of. And then the blue measures you would see are the ones that are the QI measures, which we have control over. But we still like to, from time to time, look at how the clinical measures are going. Next one is measure number 4, which is the percent of women who receive a referral or screening note to mental health services. For this measure, we've seen a lot of fluctuations. However, overall, we do see a decrease from the beginning to the present date. So we started off just around 70%, and that has decreased to about 33%. However, we are not meeting our goal set at 80% for this measure. So there's room for improvement when it comes to referral for mental health services. We will now look at our handout educational measure. It's gonna go this way. So for this measure, we've seen a steady increase over time, which is good. We started off at around 66%, and by the end of September, we had increased to about 77%. However, for this measure, we are also not meeting our goal, which is set at 100%. So there is room for improvement this as well. So that wraps up our chart review for this month. We would move over to our slides and then look at a few reminders that we have. Brooke, do you want to take over? Thank you. So as usual, data is due the 3rd of each month. If the 3rd falls on the weekend, then the data will be due the following Monday. As a reminder, you can send your data in 3 different ways. First, direct entry into REDCap, or you can complete your paper form and scan that and submit through REDCap. Or you could fax your completed paper form to Haley and she would submit on your behalf. If you have any questions related to data, feel free to reach out to anyone on the GRC team. Thank you so much.
All right. Thank you, Evelyn. As always, we appreciate you and your entire team for your expertise around our data. So thank you. Next slide. All right. As mentioned before, Dr. Halloran is here with us. Again, she is a PhD and a previous participant. Was wave 1? Was that correct? Was it that long ago?
I think so, yeah.
Oh my gosh. It feels like it's been forever and then like not at all that long at the same time. I don't know
Yeah,
how it's possible.
Kind of how life goes.
Yes. Thank you for being with us today and talking to us about care, not only for our patients, but for ourselves as well.
No, I'm happy to be here and congratulations on continuing, success in your QI project. And even when the data is not what you want it to be, at least you're tracking the data, which is really important. So you can see where you want to make some changes, which will dovetail into some of what we'll talk about today. So I'm going to talk about self-care, but it is very important to at least acknowledge that these days, there are a lot of things not in people's control, especially, well, in the world and in healthcare. So we're going to talk today about ways of caring for yourself that are in your control, but acknowledging the heaviness of things that aren't in our control also. So probably many of you have heard of the term moral injury. So if I could have the next slide, we'll talk a little bit more about what that means. So the term moral injury was first used to describe soldiers who, in their responses to being in war, because obviously we're not always in healthy situations, and sometimes we are participating in acts that we find morally repugnant. So with regard to the healthcare system, some people see the burnout as a symptom of really a much bigger problem, that our healthcare system is broken, and that the moral injury healthcare providers are experiencing is not being able to really provide the care for their patients that they were trained to provide, or that they want to provide, because the system has so many limitations. And then, the more we learn, and congratulations, Dr. Macklin, on your public health degree, the more we learn about all social determinants of health and health disparities. I mean, the health of our patients is tied to so much more than just the medical care. It's tied to all the social determinants and climate change and everything else. So we are in these systems that make things difficult. So if I could have the next slide also, because providers are really caught between, their allegiance to being an ethical provider and practicing the way they know they should, the patient care that they care a lot about, but then different policies that are impacting what can they do with this patient, what can they do in their hospital, what can they do in their clinic, and then your own self-care too, because sometimes you do need to care for yourself in order to provide better care for your patient, but that might mean saying no to something that is hard to say no to. So I just want to kind of set the stage to at least acknowledge these issues. I mean, hopefully there's some revolutionaries out there that are going to change the system and make it better in a positive way, not necessarily through violence or anything, but in a constructive way. But I just want to acknowledge that even though these things exist, we still need to figure out how to take care of ourselves. So if I could have the next slide, please. So one thing to do is to really step back and assess what you can change and what you can't change. And actually, I loved how you presented the data, how Evelyn presented the data in a different color, that some of the measures you all had control over and some of the measures you don't have control over. And I think that's brilliant that that's a way you're already doing some self-care within the study, to think about it that way, because we have to at least reflect upon what are the things I am not able to change and to let it go, and what are the things I really can change or make a difference on, and decide, if that's valuable to you, to try to push forward on that. So it's possible that your self-care is just taking the time to think about this, to give yourself time to reflect, what can I change and what can I not change? Because that is very important. We can't beat ourselves up for all the atrocities in the world, but we can still try to figure out what we can do. Okay, so we're going to talk more specifically about, self-care. So can I have the next slide? And I stole this. This was in somebody else's slide deck, but I stole it because I have a couple of points to make. It is a nice list, like it has nice ideas on it. I'm going to show you a more comprehensive list, but of course, make time for yourself, physical activity, which a lot of people put in the chat. But one of the things, I have a couple of, I guess, edits. So surround yourself with positive individuals. Well, really, we want people to be supportive, because there are a lot of positive people, but sometimes it doesn't always feel supportive. So positive and supportive individual. We're going to talk about setting goals today, but it's not just setting them. We really need to achieve them. And then it was really this last one that jumped out at me when I first saw this slide, because I guess I have a reaction when people say seek counseling or therapy when it's needed. Needed just rubs me the wrong way. We need food, we need air, we need shelter, and we need water. But to me, the question is would you benefit from it? You know, seek counseling or therapy if it would be beneficial to you. Do self-care because it's beneficial to you, and then therefore it's beneficial to the people around you. So it's not, don't just do self-care when it's somehow needed. No, when it's beneficial. And you know, therapy is a different type of, that's only one way of doing self-care. So let's have the next slide, and I'm going to talk about two things. We're going to go through a self-care checklist. People did put some ideas in the checklist, but I want you to see lots of ideas and lots of different ways. And I have this on a slide, and I know when I gave this talk before, I gave a digital copy to Haley, but I can send out a digital copy. So, and it's just a Word document. People can change it, use however you want to use it. So that will be available to you. And then we're going to talk about goal setting that will actually, that's known to be a better way to actually achieving your goals, not just setting your goals. Okay, so the next slide, please. Okay, so this is a tool that you can do a little self-assessment of ways that you may or may not take care of yourself. So, and it's divided into different sections. There's like the health, and that's what a lot of people do. We exercise. So these are just ways to pay attention to your health that are related to self-care. But there are lots of things related to self-care. Connections with others are very important. And I'm going to go through these. Finding meaning, something I call internal pleasure, and then external pleasure. So the way this would work, and the slide is a little bit different than the one-page sheet, but for each of these, you would read through it and then tell yourself, do you hardly ever do it? Do you sometimes do it? Or do you almost always do these things? And nobody's going to say almost always to all of these. I mean, that would be unusual. But if you wind up saying hardly ever to all of them, or if there's some hardly evers that you know it would be important to pay more attention to, it's just kind of a way of doing your own little self-assessment. Okay, so I think the health ones for this group would be pretty obvious. This is a healthcare. But the connections with others and your relationships are very, very important way of caring for yourselves, including interacting with strangers, which during the pandemic, that really fell off. But it's actually good for us to say hi to the checkout girl or person at the grocery store. These are things that are good for us to do, to say good morning walking down the street to a stranger. Of course, giving and receiving support from friends. A lot of times the people I'm talking to are very good at providing care for others and less good at providing care for themselves. So it's very important. It is good for us to be supportive to others, but it's also good for us to receive support. So from our friends, our family, the wider community. You know, conflict is part of any relationship. So managing those, setting boundaries. Even today, Evelyn needed to ask for help. She, you know, that was a very good self-care thing. It's very important to have the skill of asking for help when her slide wasn't coming up. And so then, you know, people jumped in and helped her. And being able to say no to protect the priorities. And one priority might be self-care. Finding meaning in your life is also very important, whether many of you through your work probably find meaning. But even kind of linking, we all have chores to do, and sometimes linking those chores to, well, there's a good reason to do this, that can be helpful for your self-care because it helps you find more meaning. And then this one, internal pleasure, which might be the most confusing title, but really these are all about kind of self-compassion. Self-compassion is very, very important. It's very important to talk to yourself the way you would talk to a friend. I know many, many people that would say things to a friend that are much more supportive, but then if they themselves were in that situation, they don't give the supportive, encouraging words to themselves. They save that for the friends, and then they kind of beat up on themselves. So it's very important to talk to yourself like you're talking to your friends, and to catch yourself if you're not. So again, a lot of these things are the kind of self-compassion, expressing gratitude is helpful to all of us. And then there's achieving goals, setting and achieving goals is one way of taking care of ourselves. And that's why we're going to spend some time talking about goal setting. And then the external things, a couple people mentioned pets in the thing. So external pleasure, I think, is easier for people to understand. Because that's what the marketing advertisers are throwing at you all the time. You know, like come see this concert, or come buy this handbag or this pair of shoes, or whatever it is, a boat, then you'll be happy. And you know, there's a role for this, but if this is the only way you do self-care, retail therapy, then you're missing out on a lot of other ways to do self-care. And this is the expensive version. Although spending time in nature just costs you the gas to get to nature sometimes if you don't have it outside your door. So I just like to show people that there are lots of different ways of taking care of yourself. And including just like humor and things like that. So humor could be enjoyable activities where you watch something that's funny. But in the first few minutes of this, Dr. Macklin cracked a joke about, well, only 3 of us are doing self-care, so I guess we need this. So humor is a very, very wonderful way to also do self-care. It connects you with others. It's internally pleasurable. And you might get it from something outside, but it's still it's helpful. So, okay, so let's go to the next slide. I'm going to switch a little bit to talk about goal setting, because goal setting is very important. But it's very easy to set the goals and make a long list of all my goals that I'm going to do. And it's much harder to actually get to the goal. So there are a couple of things that can be helpful. This is called whooping your goals, and it has some research behind it. And if you're interested, you can go to this website. But there are basically 4 steps to achieving the goal. The first is being very clear what you wish, consciously specifying, what do I want to change? What is my wish? Then the second step is really using your imagination and envisioning those positive outcomes. What are you desiring? How will things be different for you? And really spending some time with that imagery. And whenever we use imagery, the more senses we can relate to the image, the better. But to really sit and think about, okay, this is my wish, and this is how the outcome will look in my life, like make it personal for you. Then the third part, and this is the hardest part, is all the obstacles. And again, I'm focused on changes that are in your control. So we are focusing on obstacles that are the internal obstacles, the ways that you get in your own way, not the healthcare system or the world, but our own internal obstacles. And then coming up with a plan. And if I could have the next slide, I'm going to talk about the plan a little bit, because I'm sure many of you have heard about SMART goals. We want the plan to include SMART goals, where you're specific about what you're going to do. It's measurable, it's achievable, it's actually, can be done. It's relevant to what you value. It matters to you. Your heart has to be in this. And this is where it ties back to something has to be meaningful. Finding meaning in your life helps you also. There's a relationship between what's meaningful and what goals you're going to set. So how it's relevant to the things that you find valuable or you care about. And then also goal setting, it should always be timed. Like at some point, you're going to come back and evaluate, well, how am I doing on my goal? And, what needs to be tweaked? Because the first time you set a goal and make a plan, it's like a first draft, you have to go back and tweak it, and then go back and tweak it, and go back and tweak it. So it's like a constant monitoring of this. Okay, so I want to go through one example. I think I have time for one example. If I could have the next slide. of how this would happen. And so a common goal is that people want to increase physical activity or exercise. So I'll just walk through this one. So if first we'll do the Whoop and then we'll do the SMART. So if I specify the wish, I wish I felt good moving my body. I wish I could get all those benefits of exercise. I know it's so good for me. So this is my wish. So when it comes to envisioning the outcome, I need to envision feeling stronger, that I could do something, and feel strong in my body. I would have more stamina and energy, and really envisioning that. Envisioning the benefit of being less anxious and calmer. And then there's a ton of research about how my brain cells will stay young if I exercise. So that's a very powerful motivator for me, with both my grandmas having a lot of dementia. And then envisioning going to the doctor or in some other way and getting all sorts of kind of positive feedback about, wow, your health has really improved, or you look great, or wow, I didn't know you were that strong. And just really envisioning all those things and envisioning how you would feel with that kind of outcome. And then if I could have the next slide. So this is the brain is very powerful motivator for me. So, because I want those fat, juicy brain cells. So the more I can exercise, throughout my life, I can keep the younger looking brain cells and the younger looking brain. So I'm sure you've heard people put up pictures sometimes to help motivate them. So again, using all of your senses can be a powerful motivator. So this is just really envisioning. For me, I want this younger looking brain for as long as possible. Obviously, I'm going to age, but exercise will help me. So that's like my visual reminder. Okay, the next slide, please. Okay, so but then the obstacles, being proactive and reflective about knowing what your obstacles are going to be. My own, the internal obstacles to exercise. Well, you get home at the end of the day, you're tired, or or if you're trying to do it in the morning, you're tired. We're often tired, right? It's not always fun. So that's another obstacle. Sometimes the hardest part is just getting started. Those first few minutes is the hard. So identifying that that's one of the obstacles. Sometimes they're just, you're running around, you have too much to do. There's certain times of the year that there just really is no time. Some people feel very foolish trying to exercise for the first time and self-conscious, or feel very alone about it, like nobody else at the gym or wherever, looks like they look, and it kind of all feeds together. So addressing these internal obstacles has to be part of the plan. So if we have the next slide, please. Oh, I'm sorry. I guess I didn't write those out. So go back, please. I'll go back to, sorry. So the ways to address these things, it's just the way you talk to yourself. That's why I focus so much on that self-care checklist, about how you talk to yourself, the way you talk to yourself like a friend, to help motivate you and move forward. So if I have all these internal obstacles, then I have to answer them back. Well, I'm tired. Well, yes, I'm tired, but I know I'm not that tired. If I got started, I would feel a little bit better. But then also forgiveness for the days that, well, you know what, today I really am too tired. I was on my feet all day at work, or it was just hectic, and I'm just too tired today, or I didn't sleep well, or whatever. So forgiveness on the days that you really need to give yourself a break, but pushing yourself on the other days. So talking to yourself, and like the difficulty starting, like talking to yourself, well, I know I feel better in a little bit, or I don't have time. Well, I have to find time if I'm, day after day after day saying, I don't have time, I'm too tired. I don't have time, I'm too tired. Wait a minute. This is important to me. These are internal obstacles. I have to figure out a way, because this is important to me, which goes back to the goal does have to be meaningful and something you value. To be able to talk to yourself, if I say no time, well, I'm not making it a priority. How am I spending my time? What can I cut back on? So the internal obstacles, it's a lot of self-talk back to it, to remind yourself what you can do, what's important to you, forgiveness if you mess up, and just encouraging the way you would encourage a friend. You wouldn't shame a friend, you would encourage a friend. You wouldn't say it's like just give up to the friend, but you also wouldn't say, you know, well, if you don't exercise every day and you ever take a break off, you know, one day off, then you're not committed. You know, you just wouldn't be harsh with a friend. So don't be harsh with yourself when you're facing these internal obstacles and trying to talk yourself through them to address them and come. Okay. And so now we'll come up with the plan using the SMART, yes, that one, the SMART acronym. So if I'm going to come up with a plan for exercise, I need to specify, and again, it has to be achievable. So when I specify the frequency, I can't go from 0 days a week to 7 days a week. That's not realistic. So specify, what am I going to start out with? How long am I going to do it? What is realistic? How intense am I going to go? Measurable. How am I going to count this? Whatever I'm going to count, I need a way of counting so I can see my goal. Making sure that it really is achievable. You don't want to set yourself up for failure. You want to make sure that it's doable given your busy schedule. What can you do? And what do you need to scale back on? Again, the relevant, I've mentioned that a couple of times, like how is this goal relevant to your life? How is it important to you? Your heart has to be in it to really care about it. I care about, you know, managing anxiety or decreasing stress levels or my brain or my sleep or my mood or my overall health or whatever it is. And then the timing part where you reevaluate and go back to the drawing board as needed and reevaluate and go back to the drawing board or tweak it as needed. Okay, so that's just an example of how to go through the WHOOP process and then come up with SMART goals. So we can just fast forward through it because I think I have another example in here, but I don't have time for another example. Yeah, just fast forward for a few. Yeah, so I do hope that today that you can take just a few minutes today and choose some sort of goal and then write down something you want to commit to doing about that today. And also think about, okay, what are the barriers going to be and how will you overcome that barrier and how to, you know, do the WHOOP process and make a SMART plan. So, and maybe you just need to choose a goal today and then tomorrow, you know, do the commitment, because it's still better to do, if you can't do all of this today, which this could, you know, this could take 20 minutes, 30 minutes. If you can't do it all today, which would be very understandable, but if you did this for a few minutes today and then tomorrow a few minutes on this and then a few minutes on this, then by the end of the week, you might have a really good plan for the next week. So I just want to encourage people to try to choose a goal and make it realistic and, you know, go through this process. All right, I'm going to take another couple minutes and show you, maybe some of you are very familiar with motivational interviewing, but when it comes to changing a behavior, it is very difficult. It's very difficult to change any behavior. So your motivation is important. Having some, you know, skill or information about goal setting can be helpful. But these, I have two questions here that can kind of help with the motivation. So when you're trying whatever the new behavior is that you would insert here, on a scale of 0 to 10, 0 not at all important and 10 very important, ask yourself, how important is it for you to whatever the goal is? And so when it's a 10, people are very, very motivated. So that's easy. But a lot of times, many of us are very, very ambivalent, you know, like, you know, it's easy to say, well, I'm not going to eat all those Christmas cookies until they're in front of me, you know, then they are absolutely delicious. So many of us have a lot of ambivalence about our goals. So if you ask yourself, well, how important is this to me? And you give yourself some sort of rating that's probably in this middle range. Then the question is to ask, well, how come I'm a 4 motivated not to eat the chocolate cake and not a 3? So when you ask, why are you a 4 and not a 3, I'm going to start arguing for, well, because it is important. A 4 means it's more important. Well, it's more important to not eat the chocolate cake because I know that that's, overall, I can't eat chocolate cake every day. That's not good for my health. That packs on the pounds. It tastes delicious, but it's not helpful to me. So I'm not a 3 because my motivation is at a 4, not a 3, because the 3 means I'm not doing as well with my health, my weight, my nutrition, I don't feel well after I eat. So when you ask that question, why are you a 4 and not a 3, you're arguing for the change. Whereas if I ask it the other way, well, how come you're not a 5? Then you're starting to argue for, well, I don't want to give up my chocolate cake all the time. So that's how, if you ask the question in that way, you will start arguing for chore. And this is helpful with patients also. This is the motivational interviewing. So, and then the other slide, which is the same idea, then that last slide, is because behavioral health change includes both it's important for me to change, and I know I can do it. So this second question is, you're asking yourself, well, on a scale of 1 to 10, how confident am I? Like, I'm not really that confident that if the Christmas cookies are in front of me that I'll be able to say no. But you do the same thing. Why am I a 3 in confidence and not a 2? Well, because I know I can talk to myself when they're in front of me, and I know I can go to the Christmas party or Thanksgiving. I can go Thanksgiving, with a plan in mind. I can make a plan. I can do things that I know will help me. I know I have the day off. I have time to exercise that day, those types of things. So if I'm arguing again, if I ask it, why are you a 4, not a 3, then you're arguing for the ways you are confident, and you're talking to yourself in that way that is more helpful. So those are kind of my I don't know, the things that we know help people make behavioral changes, to go through the WOO process, to make SMART goals, and to then ask yourself these types of questions and listen to the reasons for it being important and the reasons that you do have some confidence. And then you can say, well, how do I move up? What do I need to do to move up a little bit if I'm down here? Okay, I'm happy to take any questions or thoughts.
You were talking a little bit about SMART goals, Dr. Halloran, and I think a lot of us have heard the concept of SMART goals, but used in a quality improvement project. But that's really kind of what you're talking about here. This is like QI for the self, or maybe QI for our patients, or what have you. But this, so I think this is certainly familiar, but that's kind of really what we're emphasizing and focusing on, and it's certainly equally, if definitely probably more important. So I think it's excellent to frame it in that way. Thank you for the information. I suspect many of us had not heard of whooping before, but definitely an interesting concept and something I will certainly be exploring further. I think in the interest of time, we will move on. If you have any questions or comments, please put them in the chat. Dr. Lazaron notes that sometimes her brain feels that chocolate cake is self-care. I would agree with that. Probably not supposed to say that, but I agree. So I'm sure many of us have thoughts like that as well. So feel free to drop things in the chat, but we will move toward wrapping up and getting you all back to your afternoons. So Brooke, if you could fast forward a little bit there, keep going. All right. So kind of end of session wrap up. The data for October is due on November 3rd, which I think is a Thursday or Friday, one of those two, not a weekend. As always, there's some options for you to get data to us. Some are listed there. Our next action period call is November 15th. This says mental health topic. For some reason, I thought we were discussing breastfeeding. But we will discuss something next month that's going to be relevant to what you all are seeing in your pediatric offices. So I guess stay tuned. Haley wants to let everyone know that if you are recertifying this year, please contact her so that she can make sure that you can get all of the MOC that you deserve or need for your recertification in time. So if this applies to you, And you will likely know who you are if this is the case. Please reach out to her so that she can help you. I think the last thing is final practice stipend details will come in November as well. So stay tuned to talk more a little bit about finances and other tangible items. And I think that's it. Oh, annual meeting coming up here in a few weeks. It is free for everyone on this call. I think to my knowledge, please consider registering. Lots of good information and sessions and work in this session or in this conference. The Ohio AAPs always puts a lot of great time and effort into making this a quality endeavor for everyone there. So please consider coming. And the registration link is there as well. Keep going. All right, and that's it. Have a great month. We will talk to you all next month. Again, thank you for your time. Please reach out if you need anything. Dr. Halloran, thank you especially for yours on this call. Bye all.